I know my Director General and the directorates are doing their best to talk to the system so that it will be revised. 1 cedi 80 pesos is woefully inadequate for a 3 square meals. Anytime you mention it, people start shaking their head, but that is what the government is paying now.
Eating healthy is a must if one must thrive throughout life. Living on an insufficient feeding fee comes with its own challenges. At the correctional facility, it is difficult to produce 3 square meals per day for offenders with the meager funding. The officer in charge of the Senior Correctional Centre, Deputy Director of Prisons, Millicent Ousu, is appealing to all to continue to support the Juvenile Correctional Centre. The health of the juveniles matters, and the Correctional Centre has an infirmary with doctors and nurses at the post who attend to sick juveniles and young offenders for the needed quality health care. Sometimes, the infirmary deals with referral cases, but unfortunately, the centre does not have its own vehicle to transport inmates to the referred hospital. It was surprising to learn how the centre deals with emergency cases.
Vehicle at the station is a big challenge. As I'm talking to you, the only mobile car is the car that I came to work with. So sometimes if I'm here and there is an emergency case, I have to give my command car out for them to take the inmate to the hospital. There are few cases that we take Uber for them to go to hospital. That is when my command car is not available.
DDP also narrates how she sometimes gets to work without a command vehicle.
Sometimes if I'm in the house and they are to come for me, when they call me that there is an emergency, they need to take the inmate to the hospital, I have to wait or take an Uber to the office so that they can use my command car to convey the inmate to the hospital. Last week, Friday, they left early in the morning to the hospital because the school bus was around. So those who were going to hospital joined the school bus to the hospital. So as I was getting ready to come, the chief officer administration called me that they were done at the hospital. So I had to pass there, take all of them together with myself, and we came to I came to work with them.
But has there been any instance where a parent has been notified that his ward is on admission and must come?
When the case is very serious, we inform the parents, because maybe you decide to come and visit the person. It is not good for the parent to come before you tell the person that, oh, your child is not well. So when the person is serious and is on admission, we inform the parent that your child is not well. Sometimes some of the parents will come along and even try to help get all the tests done.
But how does the center get its drugs for the boys?
We normally have our morning parade where they will be asked whether somebody is feeling sick or you are not feeling well. Then they will take them to the infirmary. The doctor will attend to them. Then if they need to prescribe medication, they will prescribe it for me. And when I say for me, it is not from my pocket, but the government will see to it. So the money that has been given as administrative expenses, we use some to buy medication for them. When we are soliciting for help, we cut across all areas. So medical side, hygiene side, welfare side, their food and everything.
Before an offender is admitted at the center, a psychologist takes the inmate through counseling to understand that it is possible to reform and turn their lives around from being delinquent. The center has 217 boys, 8 dormitories with about 30 inmates each in a dormitory. These boys are said to have no criminal cases, and the Correctional Centre serves as a detention to help reshape them and transition back to their communities. The juveniles, per their offence, are serving a detention period of a minimum of 3 months to a maximum of 3 years. They are sentenced for offences ranging from defilement to murder, armed robbery and unlawful entry.